Ladies and gentlemen, friends and colleagues, it is my great honor and pleasure to talk to you at the German PoTSDys-Symposium. The subject of my presentation is the role of G-protein coupled receptors in PoTS and where are we today. This is my conflict of interest statement, and we should move on. Let me start with this statement from the Washington Post, published in February 2023. A condition called PoTS rose after COVID, but patients cannot find care. COVID is causing a sharp rise in cases of postural orthostate tachycardia syndrome, a disorder of the autonomic nervous system that causes rapid heart rate, fainting, and dizziness. Now, I would like to quote Albert Einstein here. In the midst of every crisis lies great opportunity, and this is how we should look upon COVID and the pandemic, and first of all, long COVID pandemic, that created a unique opportunity for further research in this field. PoTS is a special syndrome. As you can see here, apart from obvious and diagnostic cardiovascular symptoms such as palpitation, lightheadedness, chest discomfort, and exercise intolerance, patients report neuromuscular symptoms such as brain fog, headaches, muscle weakness, and gastrointestinal symptoms just like nausea, vomiting, constipation, diarrhea, gastroparesis, and after all, chronic fatigue, which resembles chronic fatigue syndrome. This wide spectrum of symptoms suggests that PoTS is fairly like autoimmune diseases such as Sjogren's syndrome or Hashimoto disease. Now the question arises, is PoTS an autoimmune disease mediated by autoantibodies directed to G-protein couplet receptors? A few years ago, this hypothesis was proposed by Professor David Kemp from Oklahoma City University. He proposed that autoantibodies may target adrenergic G-protein coupled receptors and produce stimulation, inhibition of these receptors, or their transformation, affecting the natural receptor-ligand interactions. Now, if we can imagine G-protein coupled receptors being situated in the cell membrane and seen here from above, meaning from the outside of cell, there are extracellular loops that may catch the natural ligands and produce effects such as constriction or the change in the cell function. As you can see here, the natural ligands, they are very tiny. Norepinephrine is a tiny molecule compared with the huge receptor molecule, but quite at the same size as the part of the extracellular loop that catches the ligand. If we put immunoglobulin next to the receptor, you can see that the size of the immunoglobulin is close to the size of the whole receptor. However, if we put immunoglobulin together with the receptor, you can see that immunoglobulin is much more larger than tiny molecule of ligand, just like norepinephrine in this case. We can guess that immunoglobulins may change the three-dimensional structure of receptors and bind to extracellular loops, blocking them totally. There are different methods of detection of autoantibodies directed to G protein couplet receptors. One of the most popular methods is ELISA, where the antibody is being caught by a special antigen that in the end produces secondary effects that can be read by the special system. So in this case, you can only see the presence of autoantibody in a blood sample. However, there are other methods, such as cell-based assays, where different G protein coupled receptors are overexpressed in a special cell line, and there is a readout that can correspond to the activation of the receptor, or just living cells, just like beating cardiomyocytes. Now, looking at the ELISA methodology, we performed a study a few years ago comparing 118 PoTS patients with 80 controls from both Calgary in Canada and Malmö in Sweden. Unfortunately, as you can see here, there was no difference between the groups in any of the tested G protein coupled receptors in this standard ELISA-based methodology. Meaning that the assay could not discriminate between PoTS patients and healthy controls. Having said this, we can principally eliminate ELISA as a method of detection of autoantibodies targeting G protein coupled receptors in PoTS. However, there is another method mentioned by me before, cell-based assays that use living cells from special cell lines, specially prepared with overexpressed one kind of G protein coupled receptors, which of course makes it possible to study the cellular effects of autoantibodies. In our collaboration with Professor David Kemp from Oklahoma City University, that I mentioned before, we used Chinese hamster ovarian cells Ki1, and what we observed was a significant G protein coupled receptor activation blocked by specific antagonist. As you can see here, alpha-1, beta-1, beta-2 adrenergic receptors were significantly stimulated by serum from PoTS patient compared with controls without any disease history and with vasovagal patients. These effects were very nicely blocked by specific receptor antagonists such as prazosin for alpha-1 receptor and propranolol from beta-1, beta-2 receptors. In this proof of concept study, we demonstrated that autoantibodies in PoTS patients can be efficiently detected using cell-based assays. As you may have noticed, the most recent study on autoantibody detection in PoTS patients was published in 2020. So the question is, what have we learned about PoTS and autoantibodies during the pandemic, during the most recent years, during the years of COVID-19 pandemic and long COVID pandemic, which followed the COVID pandemic? Well, first of all, we have seen a steep increase in PoTS cases following COVID-19 pandemic and rise in the number of cases of long COVID. According to different estimates, there are 65 million long COVID patients worldwide. Probably the number which is slightly underestimated. Some estimates claim that there might be 400 million long COVID patients, which might be a little bit exaggerated. Anyway, we may count with 1/3 of these patients having post-COVID PoTS or other form of cardiovascular dysautonomia, and PoTS might be just a post-viral syndrome variant with autoimmune background, as autoimmunity and PoTS are two major phenotypes of long COVID syndrome. Thus, long COVID has become a very important research target for us who study PoTS as a vexing syndrome without any established etiology. I would like to tell you about one recent study. This is a study performed in a longitudinal way, and it focused upon assessment of serum-mediated G-protein coupled receptor activities in long COVID and autonomic dysfunction. The study included 17 long COVID patients and 11 controls from Spain. 3 samples were collected at baseline after 3 and 6 months, and what was used was the cell-based assay Tango cells from Thermo Fisher at our facility in Malmö, Sweden. 4 receptors were tested: adenosine type 1 receptor, alpha-1, beta-2, and muscarinic type 2 receptor. As you can see here, there was a longitudinal increase in serum-mediated beta-2 adrenergic receptor activation in long COVID patients. It is quite important to notice that beta-2 adrenergic receptors produce vasodilation and heart rate increase fairly in line with what can be observed in PoTS patients. So in this proof of concept study, we demonstrated that cell-based assay can catch some signals derived from serum-mediated G-protein coupled receptor activation. So if this is all about autoantibodies, how can we stop it? There are different treatment methods to target autoantibodies in different diseases: plasmapheresis, IVIG, infusions, MAPTERA, one of the emerging therapies, efgartigimod, or decoy peptides. Now, let's look at some of the recent reports to learn more about this issue. This is one of the recent studies that I liked very much. Small groups, well-performed study. The endpoint was COMPASS 31 autonomic score, and as you can see here, intravenous immunoglobulin was used to treat so-called autoimmune post-orthostatic tachycardia syndrome. The study was called I-STAND study. Interestingly, there was no difference between the groups. One group received IVIG, the other group received albumin. However, one important observation here was that there were some good responders in the IVIG group only. 4 of them, 4 out of 15 patients responded very well to treatment with a quite dramatic change in autonomic symptoms. The authors concluded that the small randomized controlled trial found no statistical difference in the response compared with albumin infusion. Both groups showed improvement possibly related to volume expansion or other effects obscuring group differences. They state that this finding may influence future immunomodulatory clinical trials in PoTS. Now, in a more recent study presented at European Society of Cardiology Congress in August this year, efgartigimod was used to treat post-COVID PoTS patients. Efgartigimod is a sort of receptor blocker which blocks antibody bindings within endosomes and preventing their reusing or recycling, which leads to very steep reduction in circulating immunoglobulins. So this steep decrease in circulating immunoglobulins, however, didn't produce any clinically meaningful difference in response. There was no difference between the groups, but both groups improved substantially. The authors conclude that efgartigimod treatment did not show clinically meaningful improvement compared to placebo on the total Malmö PoTS score and COMPASS 31. Of course, one may say that all these studies are quite depressing, as we could not impact the disease course using immunomodulatory treatment such as IVIG or efgartigimod. However, there is some light in the tunnel. Vagus nerve stimulation in this very nice study performed at Oklahoma City University, Dr. Stavros Stavrakis and his group demonstrated when 2 months treatment with vagus nerve stimulation for tragus produced meaningful effects, improvement in orthostatic tachycardia, decrease in serum inflammatory cytokines, and improvement in cardiac autonomic tone. And maybe the most important for us was decrease in G protein couplet receptor serum-mediated activity, both in alpha-1 and beta-1 adrenergic receptor assays. So there was improvement both clinically and in the laboratory assay, and especially G protein couplet receptor activity mediated by serum from PoTS patients was decreased. So now it's time for summary. Circulating immunoglobulins targeting G protein couplet receptors have been found in both PoTS patients and healthy controls, and ELISA cannot discriminate PoTS from controls. Further, in cell-based assays, PoTS immunoglobulins directly activate and inhibit G protein couplet receptors and modulate ligand-receptor interactions, but studies seem ambiguous at this moment. More studies are needed. However, IVIG and efgartigimod do not modify the disease course compared with albumin, and both groups improved, both placebo-treated and actively treated patients. And finally, vagus nerve stimulation may offer us some promise, but more studies are definitely needed. Thank you very much for your attention.